Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I have developed an interesting series, Ayurveda in a GP or Ayurveda in general medical practice. So this may be the 58th video and which may be a little bit what you can say the termination of a specific session. Of course, this series will not end. Repeatedly, once again, the session 2, session 3 will continue of this series. But at this stage, I would like to take your leave with relation to only this series. We are continuing our different interesting videos on my YouTube channel. So next few videos may be little bit of Ayurvedic medicines. Next videos may be little bit of घरेलू नुस्खे और द घरेलू उपचार. हिंदी भाषा में मैं आपके साथ बातचीत करने वाला हूं. तो अभी की इंग्लिश जो दौरान चल रहा था, बहुत लंबी तक ये मैंने सीरीज बनाई थी. कम से कम 1-2-3 महीने चल रहे थे, 2 महीने से कम हो गए इसके लिए. तो मैं आप सबको आभारी हूं कि इसको बहुत अच्छी तरह से you have given a lot of interesting response to this series of Ayurveda in general medical practice. But my dear friend, this only session 1 has been finished. There will be a lot of sessions. जैसे बोलते हैं ना कि रिमिक्स आने वाला है करके, तो आगे चलकर भी आपको मैं बहुत मेरी जो नॉलेज और एक्सपीरियंस है वो आपके साथ जरूर शेयर करता रहूंगा डिफरेंट एस्पेक्ट्स लेके. तो आज मैं चर्चा करने वाला हूं, वी आर गोइंग टू डिस्कस वीकनेस प्रॉब्लम. Actually, there is a tendency of the common doctor and even the common patient that they come to the doctor and say, Doctor, I am feeling tired. I am feeling weakness. I don't know. But please give me some interest, a very powerful tonic. Or you can make some injection course as well if you are practicing the integrated practice. But for Ayurveda, for homeopathy, for allopathy doctors, there are n number of patients who just complain that they have the weakness and they want to overcome that weakness and they want to boost up their energy. Please write interesting tonic, not the only Chyawanprash, but the different tonics. But my dear friends, dear doctor friends and dear patient friends, try to understand, unless and until you specify the reason of weakness, it is just what you can say the bushing around the bush बोलते हैं ना जिसको मतलब targeting around the bush. That is not the correct policy. You have to be very precise in diagnosis and then you can give a proper medicine for that matter. Of course, for symptomatic relief, I am giving you the different prescriptions. That's not a problem. But first, we will try to discuss some of the important causes, some of the important investigations, which you can understand why the weakness is there. It may be at the physical level, or if all the investigations are normal, if all the possibilities of physical weakness have removed, then the cause may be psychological. But the psychological weakness is a diagnosis of exclusion. You have to rule out all the possible causes at a physical level. Simple 2 or 3 things in the beginning I would like to tell you from my practice. Most of the times, if the adult person comes to me saying that for 40 plus person and if complaining of weakness, then immediately I do the blood glucose test. It may be the complete GTT, glucose tolerance test, or partial GTT, partial glucose tolerance test, or fasting and post glucose blood sugar level. That is the must to do because the diabetes mellitus is the most important cause, hidden cause. Try to understand hidden cause. It may not show you any symptom except the weakness. So you must rule out your diabetes mellitus. You can do the HbA1c test, that is glycosylated hemoglobin. If that number is above 7, that is definitely indicating that you have the diabetes. Suppose the patient don't have the time to do the fasting and post glucose. Doctor, tell me very quick. Then you can do at your glucometer, should be with the doctor, should be even sometimes with the patient who are diabetic. That glucometer, if you do the random blood glucose test, and if that random blood glucose test is more than 200 milligram, yes, it is suggesting you that the patient is suffering from diabetes mellitus problem, deficiency of Insulin, you must advise the diet, you must advise the food stuff, pathya, and also the medicines. Trayopastambha, try to understand. Sankhepatah kriya yogo nidana parivarjanam. This is the principle of Ayurveda. Try to understand, try to rule out, try to remove the possible causes. So first cause I have mentioned. Then sometimes if the lady of middle age, for example, 30 years old lady comes to me and she said, doctor, I am having a weakness and I am also losing my weight, but my appetite is good, doctor. No problem of appetite. I may suspect that the lady may be suffering from thyroid problem. It may be hyperthyroidism if she is losing the weight, and if she is gaining the weight, then that may be the hypothyroidism problem, or hyperthyroidism or hypothyroidism. I must check the T3, T4, and TSH level. Then if I find some young chap, say newly married, 20, 25 years, young dynamic person, and still he is complaining of weakness, then the cause may be some sexual oriented. Yes, he may be having guilt of masturbation. He may have the problem like ED. He may have the problem like premature ejaculation. So try to find out what is the basic cause, because patient is not directly will tell you this. So when the patient is complaining of weakness, we have to search, go on searching, go on searching. Don't give the bland without thinking, just prescribing Chyawanprash, just prescribing Polybion, just prescribing Neurobion, just prescribing Vitcofol tablet, just giving the saline, admit him for one day. No, 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 no. You must find out the probable cause of weakness. It may be tuberculosis, 6 month, 1 month, cough, evening rise of temperature, evening weakness, anorexia, loss of appetite. Think of tuberculosis. Without any, only bony pains are there, somewhere little bit feverish, and the weakness, terrible weakness. You must do the blood count. There may be blood cancer. Try to find out the cause of weakness, my dear friends. Let us see the details of these causes, investigation, and lastly, symptomatic treatment from Ayurveda. Okay. So, nervous disorders, there may be neurasthenia, too much working with the brain, psychoasthenia, too much thinking of the different things, lesions of the brain, maybe tumor inside, spinal cord or peripheral nerves, myoneural junction disorders, Amitabh Bachchan's disease, myasthenia gravis. First sign of myasthenia gravis, ptosis of the eyelid, ptosis. This indicates that the person may develop myasthenia gravis, weakness of the muscles, can't work with the muscles, can't work the normal, even walking and talking, all this becoming less and less. This is the deficiency of neurotransmitter, acetylcholine. Disorders of muscle metabolism, inadequate O2 supply to the muscles. There may be some respiratory problems like pulmonary fibrosis or engorgement, CO, carbon monoxide poisoning, then methanoglobinemia, globinopathies, and sulfoglobinemia, circulatory problems. There may be some rheumatic problems, syphilis, venereal disease, congenital heart disease, hypertension, coronary artery disease, ischemic heart disease, hypertension, coronary, what you can say, the artery disease, then constricting pericarditis, vascular lesions like atherosclerosis, thromboagitis obliterans, Raynaud's disease, hemopoietic causes. The most common for any age group is anemia. Looking very simple, but iron deficiency anemia is the most common anemia in the Indian people. Iron deficiency anemia is the most common anemia in the Indian population. And just giving the hematinics, proper dose, ferrous sulfate, tapyadilo, loha, so everything, weakness will go out, anemia will go out. Then diminished carbohydrate supply, there may be starvation, glucose essential for conversion into muscle glycogen, hypoglycemic conditions due to various causes like adenoma of pancreas, Addison's disease, Siemens disease, Hormonal problems, impaired utilization, uncontrolled diabetes mellitus. I have just mentioned that. Decreased glycogen supply because of the thyroid problem, thyrotoxicosis, lack of essential amino acids, food is not proper, food is not holistic, having appropriate proteins, appropriate carbohydrate, appropriate fats. Only fast food, fast lifestyle, and then fast degeneration. Yes, abnormal creatinine metabolism, muscular dystrophies, familial periodic paralysis, miscellaneous causes like infections may be there, diseases of the limbs following the prolonged inactivity. Apart from the above important causes, some very minor causes of weakness are in healthy schoolboy. There may be problem of nocturnal enuresis. Very young boy, there may be habit of masturbation and having a guilt in his mind, inferiority complex. Middle-aged, obese businessman or an executive, there may be ED problem, God knows, sexual weakness. All female patients must be checked for anemia, and number two, rule out leukorrhea, white discharge. Modern drugs, some modern medicines can give the weakness. Most hypertensive drugs like Inderal or Ciplarfort in large doses. All patients who are being treated for congestive cardiac failure or edema, they complain of weakness due to deficiency of potassium supplement, rather potassium. So most of our times we were used to use that Lasix as a diuretic, and sometimes it gives the deficiency of sodium. It may be giving the deficiency of potassium. So at that time we were prescribing Lasix plus Kesol, Kesol, potassium supplement. Nowadays there are potassium sparing diuretics are available. So these diuretics will not cause new diuretics will not cause the potassium deficiency, nothing to be worried about. Then depression, psychological cause may be there. So what type of investigations you are expected to do when you are feeling weakness? First, X-ray chest, posterior-anterior view to rule out the lung pathology, especially tuberculosis. ECG, electrocardiogram to rule out the cardiac problem, especially ischemic heart disease. You may have to do the stress test. You can do the 2D echo in the elderly person, because what you say, the ejection fraction, that is called as EF. Ejection fraction is very important. If it is less than 50, it indicates that your heart is becoming weak, and then we have to do the angiography to rule out whether there are blockages in the coronary artery. Blood sugar, fasting, and better way, post glucose in the non-known diabetic, and postprandial in the known diabetic to rule out the diabetes mellitus. T3 thyroid, T4 TSH to rule out the thyrotoxicosis. T3 T4 low and TSH high, that is hypothyroidism. T3 T4 up and TSH is low, negative feedback, that is hyperthyroidism. Okay, then you have to do the hemogram and ESR to rule out the acute and the chronic infections or the anemic conditions. I think I should take it out. Okay, I just want to make this out. Okay, we will go ahead. That there was an advertisement in between, no problem. ESR to rule out the chronic infections or the prognosis. ESR is not a diagnostic, it is a prognostic test. Whenever you have some chronic illnesses like tuberculosis, rheumatoid arthritis, then whether your disease is in the good progress or it is deteriorating, ESR can tell you. Treatment to rule out the cause. This is the my signal of take home message, and treat accordingly. For symptomatic treatment, there are a lot of medicines. For example, Dudh Papeshwar has a Vim liver stimulant. 1 capsule 3 times in a day. Swamala compound by Dudh Papeshwar, best tonic, 2 teaspoons 3 times in a day. Shatavari Kalpa for the calcium and for the bones strongness. So you can use the Shatavari, which is a natural resource of calcium. 2 teaspoons 2 times in a day with milk. Milk has a protein. Alpitone, Zandu company, 4 teaspoons 3 times in a day. Or another prescription for weakness symptomatic treatment, Madhu Malini Vasanta, generic medicines, that is Kalkhapri and Marich. This is the Maunsagni Vardhak, Maunsagni stimulant. So whenever there is a protein loss, whenever there is a muscle weakness, you must use the Madhumalini Vasant, 2 tablets 3 times in a day. Then Himmatavati from Hari Parshuram Aushadhalaya, Ayurveda Pharmacy from late Khadiwale Vaidya in Pune, 2 tablets 3 times in a day. The Sayana Churna with Ashwagandha, Guduchi, Shatavari, Amalaki, 1 teaspoon in the morning with the ghee. Ashwagandha Pak, 2 teaspoon 2 times in a day with milk. Then Agasti Prash, Ayurved Sevasanga Nashik, 1 teaspoon with milk. Then another prescription, my dear friends, lot of prescription by Professor Deshpande, Vigorol, jelly and tablet available by Charak Company, 2 tablets 2 times in a day. Then Himalaya Company for the elderly people, Jerry 4 tablet, 2 tablets 3 times in a day is a geriatric problem, Jerry 4 tablet. Okay, Chavanprash and Makardhwaj Yukt, 2 teaspoon 2 times in a day you can take with milk. Another prescription, oh my God, lot of prescriptions are there. Manol, color and silver coated from Charak Company, 2 tablets 3 times in a day. Or liquid you can give to 2 teaspoon 3 times in a day. Then Protsahana, that is energy boosting. Ayurved Sevasanga Nashik, sugar granules, 2 teaspoon mixed with the hot milk is like Bonvita. Okay, Makardhwaj tablet, whenever there is a Shukra Dhatu or Oja problem, 1 tablet with milk each morning. Then Arogya Mishran, Ayurved Sevasanga Nashik, 1 teaspoon 2 times in a day. Or you can give the Pushpa Dhanva Ras, especially for the ladies, 2 tablets 3 times in a day. And Aswal from Gufic Company, 1 tablet 3 times in a day. Regimen Pathyapathya, Tilataila Anuvasana every week. Tilataila Anuvasana every week. Then nutritious food you should consume, regular exercises, proper physical and mental rest, regular bowel movements, and massage, full body massage is very essential for getting the energy. Abhyanga, Abhyangaha Acharet Nityam. Ayurveda says, now and then, whenever you have the chance, opportunity, do the Abhyanga, full body oil massage. Then also you can do the Kayaseka. Then you can give the Yapanabasti, very well nourishing. Then you can do the Shirodhara for mental relaxation. So on both sides, physical and mental level, Ayurveda can definitely well treat you. So my dear friend, this is all about the common complaint, that is weakness, and how the Dr. Deshpande has tried to explain in detail about the causes, investigations, and treatment. Thank you very much. Like, share, and subscribe. This is my all-time request to you. Please do that, and I will see you in the next video. Till then, keep yourself healthy and contented. Thank you very much. Thanks a lot. See you then in the next video. Thank you very much.